this case. Dr. Yasser, you will be free now to make your case in late time?
Free, Dr. Saad, please.
First case with Dr. Yasser. Mr. Jack is 57 years old. He has been complaining of gait disturbance and recurrent falls for the last 2 weeks. You are senior officer of the medical department in the outpatient clinic, and your role is to discuss with Mr. Jack his complaint and the analysis of this complaint and the further plan of management.
So again, complaint is gait disturbance. Again, complaint.
Mr. Jack is 57 years old. He has been complaining of abnormal gait and gait disturbance for the last 2 weeks.
Only abnormal gait disturbance.
Yes, gait disturbance and recurrent falls.
Current falls. For last 2 weeks?
Yes.
You can start, Dr.
Okay.
Good evening, Mr. Jack.
Good evening, doctor. No, you are going to talk with his daughter.
With the daughter?
Yes.
But the patient 37 year. 37 only.
It's okay, but you are going to talk with the daughter.
Daughter how old? 10 years.
The patient is 57 years old. 5'7".
5'7", yeah.
The daughter is 21 years old.
Yeah. History taken, Dr. Saad. Yeah. Good morning, Mrs. Jack. Good evening, Mrs. Jack.
Good morning, doctor.
I'm Dr. Yasser, senior officer in the clinic today. I'm happy to see you.
Nice to see you, doctor.
Yeah. Can I confirm you are Mrs. Jack, the daughter of Mr. Jack, 57-year-old?
Yes, doctor.
Yeah. We are discussing about some issue about the condition of your father. Is that okay with you?
Yes, doctor.
Yeah. Please, can you tell me what do you know about his complaint?
Yes, doctor. My father has been complaining of abnormal gait and gait disturbance and recurrent falls for the last 2 weeks.
Yeah, I'm sorry for this, Mrs. Jack. Before this 2 weeks, he's completely okay?
Yes, doctor.
Yeah. Can you describe me what do you mean by abnormal gait? Can you describe this gait for me, please?
Yes, doctor, he cannot keep his balance in proper way. So he can develop recurrent falls easily, doctor.
Yeah, you mean he's swinging during walking?
Excuse me, doctor?
You mean he has difficulty in starting movement, or he's swinging during movement?
No, doctor, just he's losing his balance and he's falling down easily on the ground.
Yeah. When he is walking, he's swinging to the right, to the left side.
On both sides, doctor, then he fell down easily.
Yeah. He's swinging to both sides.
Yes.
Yeah. When he walks, he elevates his foot over the ground to high, and then stamp to the ground.
No.
Yeah. He has also recurrent falls. There is echo,
Yes,
Dr.
doctor.
Sadir. Yeah.
Yes, echo from you, Dr. Yasser.
I asked about he has abnormal gait during close his eyes, or during
I'm not
opening
sure
eyes.
about that, doctor. I didn't time.
Yeah,
I'm not sure about that.
Yeah. Sorry for this. So when he walking, he lost of there is disturbance of his gait, or coming intermittent.
No, all the time, doctor. It started gradually, but after that, it increased with him until now he cannot walk for few steps only.
So it is progressively increased now.
Yes, doctor.
Started suddenly.
No, gradually, doctor.
Yeah. What's exacerbating factor for this?
I'm not sure about that, doctor.
Yeah. You tell me also he has recurrent falls.
Yes, doctor.
Yeah. Can you tell me how many falls he has?
After few steps, the doctor, of walking, he can fall down easily on the ground.
Yeah. Before he falls suddenly or gradually?
Gradually, doctor. Now, frequency of falling down is more, doctor, than before.
I'm sorry for this. Can I ask, your father has any weakness?
No, doctor, I don't think he has any weakness in his body.
Yeah. He has any shaking movement in his hand during rest?
No, doctor. No?
Yeah. He has slowing of his movement?
Slowing? No, doctor, his movement is okay.
Yeah. Any changes in his speech?
No, doctor.
Yeah. So he has any pins and needles?
No, he didn't complain of any pains or needles before.
Yeah. He has any back pain?
No.
Yeah. He has any abnormal in his vision?
No, doctor.
Has any abnormal in hearing problems? Problems in his ears?
No.
Yeah. He has any problem in his swallowing?
No.
Yeah. So your father has any medical problems?
No, doctor, is completely free.
Yeah. I want to ask, he has any abnormalities in his memory now?
Yes, doctor, recently he has some problem in remembering the recent events, actually.
Yeah. Since how long he has this problem?
This problem may be for the last 3 weeks, doctor.
3 weeks only.
Yes.
The memory for the recent event or for the old or for both?
For the recent more, doctor, was some disturbance in his concentration.
Yeah, I'm sorry for this. What about his behavior? Any change in his behavior? More anxious than before?
No, he became more dull than before.
Yeah. What about his mood?
It's the same, doctor, no difference.
Yeah, you tell me there is decrease in his attention and his concentration.
Yes, doctor.
What about his orientation? His awareness of the place, or he lost the house?
No, doctor, up to now he's okay, and he can identify the family members well.
Yeah. But about his learning now, any decrease in his learning?
What do you mean by learning, doctor? He's 57 years old. There is no more learning.
No, about his concentration.
Yes, doctor, I told you there is problem in his concentration. There is decrease in his concentration.
Yeah. I will ask you some questions to clarify this problem for me. I'm sorry to ask you some private questions. Your father control his urine, his water work?
No, doctor, for 2 times in the last week, he lost his control in his water work.
Yeah, I'm sorry for this. So he's wetting himself during walking, during sleeping?
During waking up, doctor, he was woke up and we discovered that he wetted himself 2 times last week.
Yeah, I am sorry for this. Mrs. Jack. Mrs. Jack, I want to ask you, your father in regular medication?
No, doctor.
Yeah. I ask about he has any past medical history, any history of diabetes, any hypertension, any strokes before?
No.
Yeah, he didn't diagnose, has any Parkinson disease before?
No, doctor.
He has any family history of strokes or any medical problems or Parkinsonism?
No, doctor.
Yeah. Can I ask, he is drinking alcohol?
No.
He is smoker?
No.
What's his job?
He's retired now, doctor, for the last 3 years.
Yeah. How does this problem affect his life activity and his lifestyle?
Yes, doctor, for the last 2 weeks, doctor, we have difficulty in dealing with him because of loss of concentration and also because of difficulty of walking.
Yeah, I am sorry for this. Can I ask, your father has any history of trauma recently?
No.
Has any operation or any surgical operation or operation in his head?
No.
Yeah. You tell me his mood is low, but still life is precious for him?
Yes, doctor, sometimes he's contacting us and he's joking with us.
Yeah. So, Mrs. Jack, let me summarize what we have discussed today. If any something important or missing you want add, please add and remind me, please. Your father is 57-year-old, complaining of abnormal gait disturbance in his gait, about 2 weeks associated with recurrent falls, and also he has loss of control of his water war, and he's wetting himself 2 times over the last week. He has also problems in his memory for the recent events, and he has some episodes of losing of decrease in his concentration and his orientation. He has no weakness, no history of strokes. He has no pins and needles. He didn't take any regular medication. He has no medical problems. He didn't drink alcohol. He has any problems with his vision or his hearing. You think there is anything important you want to add?
No, it's okay, doctor.
Yeah. So can I ask you what's your concern, Mrs. Jack?
I'm concerned about his problem of weakness or his problem in his gait, doctor, and his recurrent falls. What could be the cause?
Yeah, Mrs. Jack. Actually, from this information I have talked, I need to examine your father first. But most likely, from this information, your father has condition what's called normal pressure hydrocephalus. And this makes problems in his gait and problems in his water work and the problem also in memory. So we need to do some blood tests and do some imaging of his brain to confirm this diagnosis and exclude other causes causing the same problems. And after the result, we will sit together to discuss about the management plan. Is that okay with you?
Yes, doctor. This condition can be treated, doctor?
Actually, this condition we can control the symptoms by taking some this fluid in his brain and in his back also. It will improve his condition, but unfortunately, this is not curable condition. I am sorry to tell you like this. We can control the symptoms.
Yeah, what about this fluid taken from the back, doctor?
Yeah, I tell you, we can take this fluid from the back. It will improve the condition, but it is not curable.
Yes, doctor. So he can regain his memory again and his gait again, doctor?
We will make multidisciplinary team. I will involve the nerve doctor consultant, and also the the surgeon, nerve surgeon doctor, and my consultant also. I think this fluid taken from his back can improve his condition.
Yes, doctor.
Yeah, so need make multidisciplinary team. Yeah.
Okay, so what's your diagnosis and your differential diagnosis?
My diagnosis for this 57-year-old male patient complaining of abnormal gait with recurrent falls and disturbance in his memory with urinary incontinence. Most likely patient has normal pressure hydrocephalus. and we need to
Do you
exclude
have any
other
other
causes.
essential?
We need to
Like what?
exclude other causes of ataxia, like cerebellar syndrome, like but less likely hereditary motor sensory neuropathy, like sensory ataxia, like previous strokes, like multiple sclerosis. But most likely patient has normal pressure hydrocephalus.
So what investigation you are going to do for the patient?
I will make imaging of the brain, making X-ray to radiography showing enlargement of the ventricles and dilatation of the ventricles with increase in the CSF amounts. I will make also maybe patient needs CT and MRI brain to exclude strokes, mass lesions, and other causes of ataxia also. I will make lumbar puncture for the patient to confirm diagnosis. Patient will have normal pressure hydrocephalus. So
What
the
lumbar
pressure will be
puncture?
normal. Lumbar puncture, yes. The pressure will be normal in the lumbar puncture.
What issue? Okay.
Yeah.
What the treatment for this patient?
For the treatment, I'm not sure actually because I didn't treat since some time. But I think lumbar puncture can improve the condition of the patient. Patient has increase in the amount of the fluid with normal pressure. So if lumbar tapping, it will improve his condition actually. And also I think diuresis has a role. Maybe some acetazolamide and diuretics maybe has a role also.
If the pressure is normal, so that's why to take out fluid CSF to the patient.
Because the problem not in the pressure, problem in the amount of the fluid in the ventricles and around the brain and around the spinal cord. Problem in the amount,
Okay.
not
Thank
in
you,
the
Martin.
pressure. Thank you.
Okay, open discussion. Anyone have any comment?
I think he's confusing that normal pressure hydrocephalus with benign intracranial hypertension and telling all about benign intracranial
Regarding the
hypertension.
treatments, you mean?
Yes, regarding treatment. But in the history,
Because
any
lumbar
part,
puncture is not indicated as a treatment.
Yes. Okay,
The definitive treatment is
there?
shunting, CSF shunting.
Yes.
Yes?
History, any part is missing? Any part, any positive finding?
Yeah, that's we are asking for. Anything in the history missing from Dr. Yasser?
He must do systemic review. He didn't ask about
Yes.
cardiovascular system, respiratory. Maybe there is, for example, malignancy and metastasis in CNS.
GIT,
Yes. Systemic review.
cardiovascular, GIT, and respiratory all missed from Dr. Yasser. He picked up the diagnosis early, so that I think he concentrated on the diagnosis, and he neglected the others.
Yes, could be.
And he should ask about neck pain for cervical myelopathy.
Or back pain
As a
as
differential?
well. All back pain. Yeah, back pain, maybe there is a disc prolapse or spinal cord decompression, which is cause of recurrent falls or abnormal gait. But you asked about weakness. You asked about Parkinson's disease symptoms. You asked about all the neurological symptoms.
دكتور صادق لو ممكن تقول لنا الديفرنشال دايجنوز بتاع الحاجة.
So this is a case of abnormal gait or ataxia with dementia and the urine incontinence. Most probably this is normal pressure hydrocephalus. This is a triad of normal pressure hydrocephalus. But we have to consider other differential diagnosis also. We have to put Alzheimer's disease on top of our differential diagnosis as the most common cause of dementia. And also Alzheimer's patient can develop loss of concentration, loss of control of his water work or of urination. But again, is that ataxia is not present in Alzheimer's disease. Other types of dementia also like vascular dementia, the second most common cause, or Lewy body dementia, and the Pick's disease also, which is frontotemporal dementia, also can be presented with dementia and some of abnormal behavior and also loss of control of his urination. So the main differential diagnosis with us will be with the types of dementia according to the most common type: Alzheimer's disease, vascular dementia, Lewy body dementia, Pick's disease, which is frontotemporal dementia. Parkinson can be one of the differential also, but again is that there is
اللور بادي ديمنشيا بيبقى في حاجه مميزه ليها كاركترستيك.
بيبقى في مايكلونس وبيبقى في abnormal behavior.
دكتور صالح هي
فيها hallucination visual.
تكون باركنسون بلاس دكتور صالح، باركنسون بلاس.
Parkinson plus, yes, we can be both on the differential, but Parkinson disease, there is no dementia, you know. This is not type of dementia, you know. Dementia and Parkinson very little.
About the low body dementia, I answered the Dr. Fathallah. It associated with Parkinson disease, the most characteristic for it, and visual hallucination.
Visual hallucination, mindfulness, and the dementia.
What about space occupying?
So, Dr. Yasser, regarding the treatment, the definitive treatment will be CSF shunting, ventriculoperitoneal or ventriculopleural shunting. There is no rule in lumbar puncture in this case. Lumbar puncture can be an idiopathic intracranial hypertension.
But I think lumbar puncture here may be diagnostic.
It can be diagnosed, but not therapeutic. Yes.
Yes, because if there is improvement after lumbar puncture, especially this case is acute, is within weeks.
So you mean if lumbar puncture done?
Yes, to confirm the diagnosis, we after imaging we do lumbar puncture. If the patient is improved regarding the gait especially, and even we can repeat the mini mental test to assess before and after, and if there is improvement, this confirms the diagnosis, and after that we can do the shunt. If we are sure that will be improvement of CSF tapping.
No, it is not documented actually, Marwa. What's documented regarding lumbar puncture, it is diagnostic to confirm there is normal pressure, there is no high pressure. If it is normal pressure, so that this is a way it can suggest or our diagnosis of normal pressure hydrocephalus, but the confirmative treatment, confirmative diagnosis would be in the CT scan, which shows related ventricles.
Yes.
Dr. Marwa, your voice is not strange. You attended the exam in last. You attended the exam in the same Purcell, I think.
And where?
in
Yes,
I think in
yes,
actually.
yes, I was with you in June
Yeah, the same for cell.
2013, because I entered many times.
Yeah. Okay.
So this is from my experience, because I have an experience in neurology. So this may be one of the steps, but really I didn't read. I'm not sure if it is it is in the guidelines or not. I don't know.
No, but what you are saying, that is benign
Well, I
intracranial
brought for you
hypertension.
the workup for normal pressure hydrocephalus workup. Okay, it is in Medscape. So the most cases of new onset neurological symptom of CT scan of the brain is initially obtained, although MRI is more specific than CT and normal pressure hydrocephalus. CT scan, a normal CT scan can exclude the diagnosis. CT and the MRI finds in normal pressure hydrocephalus include the following, and طبعا dilatation of both ventricles, the main finding. Regarding they didn't mention anything regarding lumbar puncture. They wrote that all patients with suspected NPH should undergo diagnostic CSF removal, either large volume lumbar puncture and or external lumbar drainage, which has both diagnostic and the prognostic value. So when the CSF opening pressure is greatly elevated, other causes of hydrocephalus should be considered, although CSF pressures may be transient elevated in NPH. Improvement in symptoms with large volume drainage is supportive of the diagnosis of normal pressure hydrocephalus. So you are completely right, Dr. Marwan. So lumbar puncture also can be used as adjunctive test to suggest diagnosis of NPH as drainage of large volume of fluid. If there is improvement of the symptoms, this is suggest our diagnosis of normal pressure hydrocephalus. Okay, so the other case, next case was Dr. Marwa. Are you ready?
Yes, doctor.
Okay, Mr. Ahmed is 27 years old. He has been complaining of both lower limb weakness since today morning. You are the senior house officer of the medical department, and your role is to discuss with Mr. Ahmed his symptoms and further plan of management.
Okay.
معلش يا دكتور صادق الحالة تاني بس عشان قمت دقيقة واحدة. ألو؟ ألو؟
Hello?
So, Dr. Yasser, don't forget to ask about all the systemic review of the patient after asking about the complaint and differential diagnosis.
تمام يا بيه تمام. الله ينور يا دكتور صابر.
ده دورك يا دكتور ياسر والله. انت طبعا you became professional now so that you picked up the diagnosis so neglected the others, but this is not not proper in the exam, you know. Okay, Dr. Amara.
Hello? Okay, this is start. What's the name of the patient? Ahmed?
Mr. Ahmed. Yeah.
Good morning, Mr. Ahmed.
Good morning,
I am Dr. Marwa, Senior House Officer of the Medical Department. Can I confirm that you are Mr. Ahmed and you are 27 years old? That's right?
Yes, doctor. Yes.
So you are referred to me from your GP as you are complaining of weakness in your legs. That's right?
Yes, doctor.
Can you tell me more about that?
Yes, doctor. When I woke up this morning from sleeping, I felt my legs are heavy and weakness, and I tried to walk, but I felt heaviness in my both legs, doctor.
So you couldn't move at all, or you move with assistance?
No, all over my legs, doctor. Yes, weakness all over my legs.
But you can walk. You walk with assistance. That's right?
Yes, doctor. Needed, yeah.
Since the morning only. Till yesterday evening, there is nothing.
Yes, doctor.
Till the first time took care for you?
No, doctor, it happened to me once before when I was 21 years old.
And how long did it last?
It lasted for 2 days, doctor.
And resolved spontaneously or with treatment?
No, I didn't seek medical care at that time, doctor, and it completely resolved without any help.
Yes. And today it is the same picture as before?
Yes, doctor, but it's more than before, actually, this time.
I'm sorry for that. So, is there pain in your legs or just heaviness?
Just heaviness, doctor, no pain.
It starts from, it involves all the legs? Or it is
Yes,
confined to a special part?
I feel it. All the legs are heavy, doctor, but I feel some difficulty in getting up from a chair, or or stay.
Or, and what about walking? If you already stand and you can walk easily, or there is a problem in walking?
No, there is problem in my gait, doctor. It is not normal gait. According to my brother, he told me I have abnormal gait and strange gait, actually.
So you fall?
No, doctor, I didn't fall down, but I have difficulty walking.
So what about your arms? Is there any problem in your arms?
No, doctor.
So is there any numbness in your legs or arms or any part of your body?
No, doctor.
Is there any headache?
No.
Disturbance in the vision?
No.
Any vomiting?
No.
So, about your speech, is this a normal speech for you, or it differs?
No, it is the same, doctor.
What about swallowing? Is there any problem during eating?
No, doctor.
Do you feel any dizziness?
No.
Do you have any breathlessness? You suffer from any breathlessness recently?
No, doctor. No shortness of breath at all.
Okay. So, any swelling in your legs?
No swelling, doctor.
Any cough?
No cough, doctor.
Have you ever coughed blood?
No.
So about your tummy, is there any problem in your tummy? Any tummy pain?
No, doctor. No, at all.
Heartburn? And your bowel motion
No.
is normal?
Yes, doctor.
What about your water work? Can you control it, or is there any problem?
No, completely controlled, doctor.
So, do you have any joint pain?
No, doctor.
Skin rash?
No.
Can you tolerate the hot weather?
Yes, doctor.
No problem with exposure to sun or any
No.
problem with exposure to sun?
No, doctor.
Is there any recent trauma?
No.
Any admission to the hospital, to any hospital recently?
Never, doctor.
Have you any fever?
No, doctor.
So, are you on medication?
No, doctor. I don't use any medication at all.
So you aren't treated from any medical problems? No diabetes, no hypertension, no other problems?
No, doctor.
Have you received any blood transfusion?
No.
Any surgery?
No.
And your weight is okay, not changed recently?
My what?
Weight, your weight.
No, doctor. No change at all.
So, what about your family? Is there any similar condition in your family?
No, doctor.
Are you a smoker?
No, doctor.
No alcohol?
No.
Have you traveled recently?
No, doctor.
What's your work, Mr. Ahmed? What's your job?
I'm an engineer, doctor. I'm working as an engineer.
So, could you go to your work easily, or you are on sick leave?
No, doctor, I didn't go to the work today because I couldn't because of this weakness.
Sorry for that, Mr. Ahmed. So, and what's your concern today?
Yes, doctor, I'm concerned about this weakness, doctor. What could be the cause?
Well, Mr. Ahmed, from the history, we can't reach exactly the diagnosis, but there is some suspicion, and I want first to examine you, and then I'll request for you some investigation, blood work, and images. And accordingly, we will arrange another meeting to discuss the results of the lab and of the images. But regarding to your first attack until the second one, there is a possibility of some disease which is called multiple sclerosis. But we want to confirm this by doing images to the brain first before we confirm this diagnosis.
Yes, and this is treatable condition, doctor?
It is controllable. Yeah, it is a chronic disease. Which differs in its behavior from a person to another. So we can't predict its behavior and how it goes. But according to the condition and the results of the images, we can start medication, and it can control the case to a great extent.
Yeah, and this weakness can come to me again, doctor?
Yes, it can. If it is a diagnosis of multiple sclerosis, or MS as we call, it can recur again. It can come. The attacks come in different pictures. So as I told you, we can't predict what will happen, but the treatment, if we start early, it will make good control on your condition.
Okay, doctor.
Any other questions or concerns?
No, thank you, doctor.
Thank you, sir.
So what's your diagnosis and differential diagnosis?
This gentleman is 27 years old, has acute onset of paraparesis, which is the second attack, with the previous attack 6 years back. And this both MS as first differential. Other differentials may be cervical disc problem, whether traumatic disc prolapse or metastasis.
You asked about
also a stroke. Yes, against there is no history of trauma, and there is no neck pain.
So you did ask about back pain.
Sorry?
Did you ask about back pain?
I asked about neck pain, I think. Neck pain, not back pain.
Okay, regarding stroke, you bought a stroke as a third differential.
Yes, this is a third differential stroke.
Bilaterally, can come in both organs, bilateral?
If it comes in the parasagittal region, it can affect the both lower limbs.
Mm-hmm. Okay, what else can cause the recurrent limb weakness? Bilateral.
There is a periodic hypokalemic paralysis.
Yes, why did you put in the last of your differential?
Maybe because this patient, this is acute onset, and the time between the attacks is too long regarding this condition.
Okay. Does it make it against periodic paralysis, hypokalemic or hypokalemic or hyperkalemic periodic paralysis? Did you ask about the restricting factors of his paralysis for hypokalemic periodic paralysis? He eats a diet rich in carbohydrates or exercise or stress or recent infection, which may be underlying risk factors for hypokalemic periodic paralysis?
No, I didn't ask specifically.
Did you ask about his weakness? Is it floppy limbs or is it rigid limbs? And actually, the patient, the surrogate told you that he has difficulty in climbing the stairs and getting up from a chair. So it shows you more that it is proximal myopathy.
Yes.
Yeah.
Yes,
so proximal weakness.
Myopathy, but
proximal weakness, so it is more with periodic paralysis.
Oh, yes.
Yeah, he just came, he woke up from his sleeping. He felt that he has this weakness. So it may be acute or subacute. So for proximal weakness, you have to put other differential diagnosis.
Yes.
What else can cause intermittent or recurrent proximal muscle weakness?
A recurrent muscle weakness?
Yes, in Graves, for example. Cytotoxic periodic paralysis can be?
Oh, maybe.
Okay, what investigation you are going to do for the patient?
Maybe myositis, but I didn't ask about, I think I asked about pain. I asked him if there is pain in his lower limbs. But
he denied pain.
Yes. If there is pain, it will be, myositis may be in the differential.
Okay, what you are going to do as investigation for the patient?
First, I'll do for him routine lab investigation, complete the blood count, liver and kidney function, ESR and C-reactive protein. I can ask for him vitamin B12, folic acid, thyroid profile, potassium, electrolytes.
Why vitamin B12 and folic acid? Why you are asking for vitamin B12 and folic acid?
This is a routine investigation for neuropathy.
Yeah, but he has any numbness or tingling sensation?
No, but maybe there is motor weakness. This is motor weakness, not sensory.
Okay, you will ask also for serum potassium?
Yes.
Serum potassium?
Then
what else?
Then I'll do for him first CT brain, and if there is no contraindication, then I'll proceed to do lumbar puncture for CSF analysis, and arrange for MRI brain and the spinal cord.
This is for MS.
And yes, and to exclude any
So
other causes if there is stroke. If there is stroke.
You are still insisting that most probably it is MS.
No, I'll do investigation to rule out all the differentials. So it is, if I want to rule out MS, so I need to do CSF and MRI.
Okay.
Especially if there is no abnormality in the lab, if the potassium is normal, thyroid profile is normal, everything. So I should proceed.
Okay. If the potassium is normal, does it exclude hypokalemic or even normokalemic periodic paralysis? Sometimes the periodic paralysis can come with normokalemic periodic paralysis.
Okay, so it will be
you will do thyroid function test?
Yes.
Thyroid function test?
Yes.
For what?
If there is thyrotoxicosis, maybe a cause for myopathy. So I'll do also CK.
Thyrotoxic periodic paralysis.
Yes. And CK also for.
Okay, thank you, Doctor.
Okay, thank you.
Okay, open discussion. First in the history.
دكتور صادق
narcolepsy, cataplexy. Any psychological?
I didn't hear anything yet. Dr. Ball?
Yes. This indifferential, myasthenia gravis, cataplexy, narcolepsy, then psychological stress, all will be differential.
Yes. Any other comments?
هو يعني I think when we just
Dr. Fathallah, you have lots of echo.
Dr. Sadiq?
You can. Dr. Yusri, اتفضل.
هو بالنسبه للكلوز الدكتور فتح الله بيسال عنه في الفيز دي زي ما حضرتك بتقول اللي هو البسبيتيك فاكتورز فور ذا اتاكس والموست طبعا امبورتنت ان اسك اباوت ذا دايت يعني increase carbohydrates like what like so this is the clue for this case and I think in also in يعني in taking history of the previous attacks she should focus in this attacks. Patient admitted at this time, how it's improved, for how long this weakness. It will give also a clue for the case.
She asked already about for how long, and he told her for 2 days, which is pure discontinuous without any help.
Yeah, this is also going.
But what about the analysis of the complaint itself? Analysis of the complaint to narrow the differential diagnosis.
I am agree with you. She should first differentiate between upper motor and lower motor. Ask about this is a floppy weakness or rigid weakness, as you said, muscle floppy or rigid, and the weakness which
is it proximal or distal?
Yeah, distally or proximally. Yeah. For any lower limb weakness, back pain. Forget back pain. Maybe misses the case. So back pain is essential.
Yeah.
Also for urinary incontinence and bladder and stool incontinence should be taken at the same time. Also with the sensory loss at the same time should be asked at the same time. And other neurological other neurological signs are also wasting of the muscle. If there is any wasting of the muscles, patient has attacks before.
Okay, so first of all, analysis of the complaint is the main issue in our case, because it will narrow your differential diagnosis. So this is a case of bilateral limb weakness, which is recurrent, so that you have to analyze the complaint when this weakness started exactly. Is it started suddenly or gradually? And you have to ask about precipitating factors or worsening factor for this condition, like carbohydrate diet or exercise or recent infection or bad mood, because these all are risk factors for hypokalemic periodic paralysis. We have to ask about the site of weakness more. Is it proximal or distal? But not like that. Is it proximal or distal? No, this is not acceptable. You have to ask about you have any difficulty of getting up from a chair or climbing a stair, because this will show for you there is proximal weakness. For distal, you will ask about when you are walking, you have to elevate your foot from the ground. This is for distal weakness, or foot drop and distal weakness. So this patient has proximal weakness, and this will narrow for you the differential diagnosis. Proximal weakness.
Sorry, Dr. Saleh, for disturbance, for interruption. For distal weakness, can ask one question only. You have any problems in wearing your trousers or your shirt? وبالنسبه للبروكسيمال ويكنس زي ما حضرتك قلت اللي هو difficulty يعني in walking up from a chair.
Okay, Dr. Yasser. طبعا you have to ask about any other weakness in the body, any upper limb weakness or not. So you have a case of recurrent periodic proximal weakness, and this will narrow for you the differential diagnosis more and more. We have 5 to 6 conditions with recurrent proximal weakness. Number 1 is hypokalemic or hyperkalemic or even normokalemic periodic paralysis. The second common is cytotoxic periodic paralysis. Other case, like Dr. Paul said, myasthenia gravis, so that we have to ask about all symptoms of myasthenia gravis. And before that, we have to ask about all symptoms of hyperthyroidism. And all symptoms of myasthenia gravis, like diplopia of vision, like this fatigue at the end of the day, eye drop. Myasthenia gravis, one of our differential diagnoses. Other differential can be botulism also, but botulism is ascending paralysis, actually not. Is this descending paralysis, not ascending paralysis, but it affects also the proximal muscles, so that we have to ask about canned food. Other differential diagnosis also for this case can be Lambert-Eaton syndrome, as can cause proximal myopathy. So we have to ask about, Lambert-Eaton syndrome can be paraneoplastic syndrome from cancer lung, for example. So we have to ask about all symptoms of chest symptoms, coughing up blood, loss of weight, high temperature, lumps or bumps in the body. So Dr. Marwa طبعا did ask about the hyperthyroid symptoms, very important. Myasthenia gravis symptoms, very important. Chest symptoms for Eaton-Lambert syndrome, very important. Dr. Yasser, تفضل.
What about lead poisoning, Dr. Sabir?
It will not be acute like that, Dr. Yasser. It will be very
but
gradual.
can be intermittent, Dr. Sabir. But can be intermittent also.
Lead poisoning, I think it causes
Yes, in this scenario.
And not proximal myopathy, Dr. Yasser.
Yes.
Can cause proximal myopathy, Dr. Sadi. It is one of the differential of proximal myopathy. Lead poisoning, causing motor neuropathy. Proximal more than distal.
Yes, neuropathy will always cause distal, not proximal. Neuropathy will cause distal more.
Yes. No, it really cause trouble, the foot drop. Yeah, and not to widen the differential diagnosis, just the most common differential diagnosis of periodic, this patient has 2 attacks of limb weakness, young patient. So we have to put, in proximal weakness, we have to put hypokalemic periodic paralysis, hyperkalemic periodic paralysis, or normokalemic, cytotoxic periodic paralysis. There is others which is called the paramyotonia congenita, but it is more rare, so we don't have to mention it early. And also what's called Anderson-Towel syndrome. Also, this is also very rare, so we don't have to mention it early. So after that, we have to mention myasthenia gravis, 8-number syndrome. It's Cushing. Cushing also is one of the differential of proximal myopathy, but not in that way also. So we don't have to put it in the first of our differential, in the last of our differential.
Okay, similar like spastic, periodic paralysis, there is traveling history is important because the tropical spastic paralysis because of STLV infection, that is also will be there.
But this is caused upper motor neuron spastic paraparesis, Dr. Paul, I think.
Yes, upper motor
One
neuron.
One of the causes of the spastic paraparesis.
Yes.
Regarding investigation, Dr. Marwa, there is no need for CT brain or lumbar puncture or MRI for the patient. He would consider you that you are in prescribing non-needed investigation for the patient. It looks like lower motor neuron weakness from the prescription of the weakness proximal more. And there is no upper motor neuron symptoms at all, no other neurological signs at all. So it is a case of periodic paralysis for differential diagnosis. The first will be hypokalemic and normokalemic periodic paralysis, cytotoxic periodic paralysis, myasthenia gravis, 8-numbered, Cushing botulism can be in the bottom of our differential.
But why, doctor, you don't put MS as one of the differentials? It may present in the field lecture,
proximal more, proximal more.
He told me it is during walking he still feels weak and unsteady. It will be confirmed by examination, but at the level of the history, we can't rule out.
No, but again in multiple sclerosis there will be a spasticity. There will be upper motor neuron feature.
Yeah, if you ask it about is it floppy or rigid, he will tell you it is floppy limbs, and this is going with lower motor more. Because if we put MS as differential.
I mean, in acute paraplegia, in the acute phase, there will be flaccidity, not spasticity in the acute phase.
MS not present like a flaccid. MS always present as upper motor neuron spastic. So MS will not be here as means on the top even 4-5.
But if it is acute,
sensory level. Should we have loss of sensation?
No, that
sensory level
is loss of sensation. That means something in a spinal cord. If there is a loss of sensation means something in a spinal cord. So loss of level should not be there. it is vague without sensory level, but spasticity will be there. Then if
دكتور
it is
رشا
MS or motor neuron disease.
بص the key in the case is it is a continuous or intermittent and floppy or stiff.
Correct. Intermittent.
And the proximal or
and
distal?
floppy. Yes, yes.
Proximal or distal. Because intermittent paralysis has a differential diagnosis from has another differential diagnosis than stiff.
Correct.
Yeah, and lower limb weakness and posterior limb paralysis, we have maybe more than 20 or 30 differential diagnoses. So if we didn't narrow the differential diagnosis, we will be in dilemma, So we excluded there is spastic paraparesis already with the patient, so we will not mention anything about spastic paraparesis causes, which is many causes, more than 10 causes maybe. So now it is a proximal periodic proximal muscle weakness. And this is would make only 4 to 5 differential diagnoses. And this is what we want. In the exam, you are not asked to mention all the differential diagnoses of the limb weakness, so that we would consider you as a text doctor. You have to mention only in all the cases 4 to 5 differential or 3 to 4 differential in the top of your differential. This case came before, I don't remember which center, but hypokalemic periodic paralysis can come in the exam.
Yeah, it already came before.
Mm-hmm. Okay, next case will be with Dr. Muhammad Fathallah, then with Dr. Rasha, then with Dr. Pal. Dr. Fathallah.
أيوة دكتور صادق مع حضرتك.
Communication skill case. Mr. Omar is 60 years old. He has been complaining of abnormal behavior recently and forgetfulness for recent events. And genetic testing done for him confirmed that he has been complaining of Huntington disease. You are senior officer of the outpatient neurology clinic, and you are about to meet his daughter, Mrs. Layla. She is 27 years old, and you wrote to inform her about her father's condition and any concerns she has. Just when Dr. Fathallah is ready, I want to confirm that we have 7 skills in the exam. Picking up physical science, differential diagnosis, proper examination, and patient welfare, patient concerns, and management. So you have to pass all the 7 skills of all the station. Okay, I agree with you. Just I want to clarify.
معلش آخر حتة في السيناريو عشان الصوت كان interrupted بس.
طيب, the scenario again. Mr. Omar is 60 years old. He has been complaining of forgetfulness recently and abnormal behavior. Genetic testing done for him and confirmed that he has Huntington disease. You are senior officer of the outpatient clinic, neurology clinic, and you are asked to meet his daughter, Mrs. Layla, who is 27 years old, to inform her about your father's diagnosis and any concerns she has.
طيب نبدأ يا دكتور صادق.
Okay.
Good evening, Mrs. Layla.
Good evening, doctor.
I am Dr. Muhammad, Senior House Officer at the Neurology Department. It is nice to meet you today.
Nice to meet you, doctor.
I confirm that you are Mrs. Layla, 27 years old, the daughter of Mr. Omar. This is true?
Yes, doctor. Yes.
Are you the next of kin of Mr. Omar?
Yes, doctor.
Do you want any of your family member to attend this meeting, Mrs. Layla?
No, doctor. It's okay. I can manage myself.
Okay. So, what you have been told about your father's condition, Mrs. Layla?
Yes, doctor. The consultant told me that he's going to do some investigation and a specific blood test, which is called genetic test. So I'm coming today to know the result of this test for my father, doctor.
Yes, Mrs. Layla. You know that your father, Mrs. Layla, came complaining abnormal behavior and forgetfulness, okay? And genetic test done
Yes,
for him. So, what is your expectation for his condition?
I don't know, doctor. I don't have a specific expectation for that. I'm just wondering for this abnormal behavior and his forgetfulness recently. I think maybe he has what's called Alzheimer's disease.
Actually, Mrs. Layla, the result of the genetic test confirms that your father has what's called Huntington disease.
Yes, doctor. Is it a serious condition, doctor?
Actually, Mrs. Layla, it is a serious condition, and actually it is also a progressive disease. So, do you know anything about this disease, Mrs. Layla?
No, doctor.
If you want, I can tell you more about this disease.
Yes, please, doctor.
Actually, Mrs. Layla, this is a progressive disease which affecting the brain and affecting the function of the brain. It leads to impairment, leads to abnormal movement of the body, also affect the memory and the cognitive function. Okay, and also it affect the muscles which help us to swallow the food and all the muscles of our body. So what you feel about this?
Yes, doctor. I feel sorry, doctor. I didn't think it is a serious condition like that.
I'm sorry to tell you this, Mrs. Layla. If you want to delay the discussion to another time, we can end now.
No, it's okay, doctor. Go on.
Okay. So, as I tell you, Mrs. Layla, the persons who have this, once the disease is started, it is a progressive, and it can lead to abnormal movement of his hands, of his body, also affect his memory and his judgment and perception, and also leads to weakness of all the muscles of his body. And at the end of this disease, is dependent on the aid from the others. He needs someone to help him for the physical movement, for feeding, for everything. So what do you feel about this,
Yes, doctor.
Mrs. Layla?
I feel so sad. I feel so sad for that, doctor. But there is no cure for him. There is no special treatment or special care for him, doctor.
Actually, Mrs. Layla, unfortunately, there is no cure for this disease, but there is a lot of things we can do to help the patient who having this disease. We can arrange a multidisciplinary team. This will including the doctor specialized in the brain, also will include the social worker, the occupational therapist, and the internist and the nurse supervisor. And we can do for him physiotherapy. Also, the occupational therapist can do some practical solution him in his daily life. And the neurologist and the doctors specialized in the brain can give him some medicine, try to slow the progress of the disease. So what do you feel about this, Mrs. Layla?
Yes, doctor. I'm just trying to absorb this information, this hard information. So this disease is can run in family, doctor?
I'm sorry again to tell you, this disease is hereditary disease.
What do you mean by hereditary, doctor?
Means that every kid, Mr. Omar, having a chance 50% to having this disease, and also 50% not
So
having
I
this.
can have this disease, doctor?
Actually, Mrs. Layla, no one can predict what is happened in the future. But if you carry the abnormal gene, you have a 50% chance to having this disease in the future.
And when these
I'm so
symptoms can
sorry to
appear
tell you.
on me, doctor?
As I tell you, Mrs. Layla, no one can predict what is happening. There is no specific time for these symptoms to occur. Okay, it can occur at any time of the patient's life, but once it is started, it is progressive.
Yes, doctor. Can I do this test, doctor, to confirm that I have this gene or not?
Okay, Mrs. Layla, you have the right to having this test, but I prefer if you discuss this with can you tell me first, are you married, Mrs. Layla?
Yes, doctor. I'm married and I have one kid.
Okay. Are you a smoker?
No, doctor.
Did you drink alcohol?
No, doctor.
Did you,
What, doctor?
did you have any history of diseases like diabetes, hypertension?
No, doctor. Me, I don't have any medical illness.
So, Mrs. Layla, as I tell you, this test is available, and I can refer you. But I prefer if you discuss this with your husband first, and take a time to take the decision. But if you want to do the test, I will refer you to the local genetic office. This genetic office containing the doctor is specialized in the genetics and the technician, and they will take a sample from your blood to test for the abnormal gene in your blood. Okay, Mrs. Layla?
Yes, doctor.
But
And
actually,
if you discovered this gene early, doctor, you can offer me treatment before the symptoms appear on me.
I appreciate your concern again, Mrs. Layla, but as I tell you before, no one can predict when this disease can affecting you. Okay, this disease can affecting you at any time, but the only thing that can slow the progression of this disease or the beginning, that you keep yourself in eating a healthy diet with regular exercise, avoid smoking, avoid over drinking. But no treatment actually
this can prevent this disease. This can prevent the disease from happening for me, doctor.
Actually, it prevents this disease totally, but it helps to the start of the affection of the disease. But this is not the treatment for prevention. But as I tell you, also this test having a false positive test, this genetic test, you should know that this test is not, there is no guarantee for the test. It is not 100% false positive also results. You should know this before you go to the test.
Yes, doctor. Yes, doctor.
Also, if the test is positive, I think this will put too much anxiety on you, and also will affect your. You should inform your life insurance and health insurance. So you should take a time to think about this test, and you have the right to do or not this test. Okay, the decision will return to you at the end. Okay. So, do you have any other concern, Mrs. Layla? Yes. Do you have any other concern?
No, doctor.
So I will summarize to you, Mrs. Layla, that Mr. Ibrahim has complaining of abnormal behavior and forgetfulness, okay? And the genetic test confirming that he has a disease called Huntington disease. And as I inform you, this Huntington disease is a progressive disease affecting the brain and leading to abnormal movement, also leading to affection of the memory and progressive weakness. And as I tell you, we will do a multidisciplinary team, and this team will follow your further condition from time to time, and we will give you a full support either in the home, by either if you need a support. Did you need anyone to support your father in home, Mrs. Layla? We can offer a nurse that care for him. Your father in home.
Yes, doctor. You know, my father is living alone, and my mother died 2 years back, so that he's living alone. So, you know, I'm concerned about who will take care of my father.
So, Mrs. Layla, as I will contact the social worker, and he can offer a nurse that can care for your father, either for a full time or a partial time. Okay, Mrs. Layla?
Yes.
She can give him the medicine. Also, the occupational therapist will help him to do practical solutions for his home, for his forgetfulness. Okay.
Yes, doctor.
And the doctor is specialized in the brain. He will give him some medicine, and we will follow him from time to time. And if any complications happen from the disease, we will deal with it, and we will inform you by any steps before we are going to do. Okay?
Yes, doctor. Okay, doctor.
Also, I inform you about the genetic test, and I want you to think about this test first. And if you decide to do the test, I will refer you to the local genetic office, and they can do for you the test. And it is a blood test, and the result will be delivered within 1 week. But as I tell you, there is it carries some false positive. There is no guarantee that the test is 100% true. So can you tell me how you got from our conversation today?
Yes, doctor. I know that my father has a disease. It's called Huntington, which is affecting his memory and his movement and his behavior. And so that you are going to manage him in multidisciplinary team. And also, if I want to do the test, I have to sign a consent for that. And you are going to do for me the test, which is his risk to be maybe negative or false negative or false positive test. Thank you for that, doctor.
Thank you.
فيش help؟
ما انت قفلتني بالكونسنت. انا نسيت الكونسنت خالص. Okay, so I will give you some leaflets and websites and pamphlets about Huntington disease. You can know more information about the disease, Mrs. Layla. This is okay for you?
Okay.
And also, this is my contact number. If you have any questions or any queries about the disease, you can contact me at any time.
Okay, thank you, doctor, for that.
Thank you.
مش هتسأل حد يوصلها ولا حاجة؟ Anyone arrive here to home?
If you want, I can offer one to drive you to home, Mrs. Layla.
No, it's okay, doctor. My husband is coming soon to take me.
No problem.
Thank you, doctor.
You can take me or told you. Thank you.
Okay, take me with you also, please. I did 2 cases in 1 case actually. These are 2 cases in 1 case. It is a case of Huntington disease counseling and the genetic counseling. Actually, it is not coming in the exam like that. It's coming separated. Genetic counseling and Huntington disease counseling. So I mix them both together to just have information about both as much as possible. So regarding Huntington counseling, do you think, Dr. Fathallah, you covered all the information for the patient?
Yeah, it is difficult to cover because I will cover all the information about the genetic counseling. I try to give a hint about the most important information about that it is disease is no cure. It is the patient will be totally dependent on the care in the end.
Yeah, regarding this disease, did you tell her that you have to put medical alert process on the hand of the patient because he may be lost at that time, so that anyone can find him so can call you back? This is important in Huntington disease actually to put medical alert process on the rest of the patient to identify the patient anytime when he is lost. And that your father may have abnormal behavior in the form of urination or wetting himself maybe, and can do some behavior which is embarrassing, so that you have to know about this condition, not to be so shocked when you saw his abnormal behavior like that. You covered all the symptoms of Huntington disease. It is a progressive gradual progressive degenerative disease which is affecting the nervous system of the patient in the form of amnesia of the events and abnormal behavior and abnormal shaking movements of the body. and also difficulty of concentration and perception and attitudes of the patient. It is gradual and progressive, so that we cannot guarantee when his condition will be deteriorated and how much he will be deteriorated, and for how much time. There is no treatment available for your father, unfortunately. I'm sorry for that, but we refer your father to a multidisciplinary team composed of neurologist and the social worker and the psychiatrist and the occupational health care to give your father the proper help and proper care. Also, don't forget about medical alloprosil for the father. Also, don't forget about the mode of the inheritance of the disease. This disease is autosomal dominant. It means that it affects 50 members of the family, or maybe every one of the family has 50% to have the disease, unfortunately. If she asked you when the symptoms will appear, it is different. This disease is different from patient to the other, so that we cannot guarantee when the symptoms, like Dr. Fathallah said, when the symptoms appears on the patient and at what time and how much the progression of the and how rapid the progression of the disease from patient to the other. Dr. Fathallah, he forget the social history of the father. Can I know what your father do for life, and if he's living alone, anyone supporting him? Because in such this patient actually they are, this patient are living alone, so that he's checking how much you will deal with a patient is living alone with morbidity. So if the patient, if he is living alone, I'm sorry for that, we can offer him a specialized nurse to take care of him and give him medication and to both تمام يعني. بس عشان ما تنساش برضه social history of any patient, very important for whom the patient was living with, and what he was doing as a job, and how much his symptoms affect his usual daily activity and his job, smoking history, alcohol history. ممكن عشان هو two cases in one case you felt some compression. This is the first case of counseling for Huntington, Korea. Another case involved in this case, genetic testing, which is coming separated actually. And the most probably the patient is coming because her father has Huntington disease, and she heard that this disease runs in families, so that she is coming for genetic testing for herself. Dr. Fathallah covered this in proper way also. But Dr. Fathallah, do you think the patient has to write consent for genetic testing or not?
For the genetic test?
Yes.
I think
yes, it is informed consent actually, has to be written. For Huntington genetic testing, you have to ask the patient why she wants to do the test first of all, because you have to check if the patient is pressurized from anyone else to do the test or not, or she is completely free to do the test. So you have to ask here if she is pressurized from anyone else to do the test or not. And ask here how much she know about this condition, Huntington Korea, and how much she know about this test. Then try to explain this test for her. This is a blood test which is done by a blood sample taken from her after a consent. She has to write a consent for agreement of this test. And this test will be available within 24 to 48 hours. And confidentiality here is very important. Dr. Fathallah, inform her about that. The result, if the result is released, it will be completely confidential for you and will not be released by letter or by email, and she is the one to take the test, the result of the test. So confidentiality here is very important in a genetic test, and that this test can carry false positive or false negative results. Okay. And if the test is positive, it means that she may have the disease, but you cannot guarantee when the symptoms appear in her case. And if the test is negative, it doesn't exclude that she has Huntington disease. It may be false negative. She may need to repeat the test again if she wants. And you can give her hints about Huntington disease symptoms also, in this case, genetic testing. Again, for any case, if the examiner asked you about the ethical and legal issues in any communication case, it is fixed. It is autonomy, that the patient has the right to know about his condition and has the right to share the management plan, beneficence and non-beneficence, to do well or to do good for the patient means beneficence, non-beneficence not to do harm for the patient, justice for the patient. The patient has the right to be treated regardless his religion and his race or his color. And some cases has confidentiality, like this case, or HIV infection, for example, or the results. Confidentiality is important. That's all in this case. Anyone want to add any comment?
Sorry?
Dr. Yasser, تفضل.
For the test itself, as Dr. Fathallah said, it will has effect in the work, effect in the insurance. So the patient should be aware of this, and also the risk of the people. If the test is positive, the risk for the people at risk, like her children, and also the brothers and the sisters. And also about the information will be taken about the father, which is positive, which has the disease.
Dr. Yasser. We mentioned that everyone in the family will have a chance to 50% to have the disease. And social history is very important in each case of communication and the history and station 5.
وطبعا زي ما حضرتك علمتنا دكتور صادق هو الجود ايشو في this case patient planned pregnancy. If the patient has planned pregnancy, to avoid any children with Huntington disease by هي pre-implantation. Prevent by pre-implantation can be prevented, and by taking the sperm which is affected or the ovum which is affected and avoid to fertilize. So can be avoided, can be prevented, can. So this is a good thing.
I should raise this issue.
تفضل.
يعني I should raise this issue even.
والله Dr. Yasser, this issue of implantation, I didn't read it in Rider. In this case in Rider, they didn't mention about this implantation and about avoidance of Huntington. What do you think, Dr.
موجودة
Paul?
على ال NH يا دكتور صادق. موجودة على ال NH.
موجودة فين؟
بس على ال NHS بس ده لو البيشنت come pregnant and she want to do the test even before 14 weeks اللي هو الكوريونيك villus sampling or after 14 weeks or if she is planning for pregnant here we can do for you pre-implantation fertilization.
Pre-implantation test
We can offer this
فتح
if she is planning.
هو actually this question asked
Before
when
being pregnant,
screening.
yeah?
To solve this test can be done for male or female, for males and females who plan to be pregnant and has history of Huntington disease to prevent this from occurring in the children by making pre-implantation test to see if the ovum or sperm has affected to avoid to fertilize this ovum or sperm. So you can prevent this.
Mm-hmm.
Hello?
I think we should better offer that we will refer you to genetics physician for this,
I want
and he
to
will
ask-
solve this problem. Because it will be very
Yeah, reference for genetic,
genetic physician that we will refer, and he will decide when to do it is 14 weeks or before fertilization or before what, when it will be best. So this all will be decided and done by the genetic physician.
genetic counseling team, yeah.
Yes, yes.
I want to ask during this discussion with the Reddit, if it has any like hypertension, diabetes, because the patient can take his medication and he's not compliant because he has abnormal behavior. I mentioned this during discussion with the patient. And also the patient...
Sorry, the voice is very interrupted.
Okay. Can I ask during discussion?
Yeah.
The pre-morbid of the patient, that is he's hypertensive or diabetic because he cannot take medication in a proper way.
Yeah. Yeah, I agree with you. You have to ask about the condition of the patient, the condition of the patient before have the disease. Yeah.
Also,
social history.
The team. Okay, it must inform the psychiatrist because this patient can be progressive suicidal attempt.
You can go into severe depression. Can be one of these social, one of the team, one of the multidisciplinary team is psychiatrist. Yes.
Okay.
Okay. Next case. Hope that's enough for today.
لو عندك حاجة في الشغل ما نعملش كده.
I'm just asking يعني all are silent so سكوت علامة الرضا الناس تقريبا they want to sleep.
أنا أستاذ بس حضرتك next session when we will take.
Me.
أنت عايز إمتى يا دكتور ياسر؟
يا بيه أنت شوف الوقت اللي يناسب حضرتك لأن أنا عارف إن حضرتك اليومين دول في زحمة الله يعينك.
يا باشا أنا أفضي لك نفسي وحياتي كلها.
كلام كبير يا بيه والله كلام كبير يا دكتور صادق ده.
الله يخليك يا دكتور ياسر. Okay, tomorrow we will continue the cases.
تمام. تسلم يا دكتور صادق.
Very interesting cases tomorrow. do?
الساعة كام يا بيه؟
بكرة الساعة كام؟
11:30.
تحضر بدري يا دكتور محمد، ما تغيبش كده.
والله المشكلة عندي بكرة عند دكتور رمضان الساعة 6، بس إن شاء الله نلحق يعني.
إن شاء الله بيه، إن شاء الله.
تدخل امتحان يا دكتور
Dr.
هاشم؟
Ball, tomorrow Dr. Ball, you will present tomorrow, inshallah. I'm sorry that no time today for you to present.
Okay.
Well, tomorrow we'll start with you.
Okay.
Also, Dr. Fathallah, Dr. Yasser, Dr. Marwa. I'm sorry for the other candidate because we are making the candidate who are going for the exam to present. Dr. Asha, I don't know if she's here or not. I think she left already. Tomorrow, inshallah, we'll do a lot of this.
الو
والله اللي عندك مش قدامي على فكرة خالص.
مستنية دوري
طيب
من الصبح.
عشان دكتورة رشا ما تزعلش من دي حاجة يا جماعة. اوكي. agree.
بس اديها ديفيكالت كيس يا دكتور صبري. اديها ديفيكالت كيس
ليه
لو
بس
سمحت.
كده؟
She's going to the exam, so you don't want to suppress fear here. Okay, Dr. Rasha.
Session 5.
No, this is a case of communication if you want. It's okay, communication, or you want station 5?
والله
داون.
اللي يجيب ربنا كويس أي حاجة.
داون تقدمي داون.
لا بلاش داون.
انت كده مش عايز تعمل لها ديبريشن؟ انت كده مش عايز تخش امتحان خالص يا دكتور صالح.
داون جت قبل كده. Down came before in the exam, and you are going to present tomorrow, okay?
خلاص ماشي. جت امتى أنهي إكزام أنهي دايت؟
والله مش دكتور ياسر. I think you know down get in which exam.
دكتور صادق هي داون صراحة ما جاتش في اكزام، هي جات نزلت الدكتور أحمد ماهر كان تقريبا يعني كان نزلها في حالة بالحالات على أساس إن هو كان بيقول ممكن تيجي يعني.
I think جت في إنجلترا.
والله إنجلترا دي كل حاجة
I
دي.
think so.
ماشي لو جت عندنا في المعادي هحط ايدي بالشوار.
سلام دكتور صادق.
هتمتحني في المعادي يا دكتورة مروة؟ دكتورة مروة.
أيوه.
أنا؟ أني دكتور؟
هتمتحني في المعادي؟
دكتورة مروة في الكويت.
لا أنا في قطر إن شاء الله. أو افتتح الامتحانات في قطر إن شاء الله.
ربنا معاك في المعادي. كنت أعرف بس الحالات.
لا لسه في ديسمبر بقى إن شاء الله.
الو دكتور صادق.
ربنا معاك.
دكتور مروان اتفضل.
ربنا يخليك. شكرا.
بس حابب اعرف نفسي على المجموعه. دكتور مروان من اساسا من السودان ومتصل من السعوديه يعني، وان شاء الله next exam من الكويت. I hope you enjoy his groups and get benefit إن شاء الله.
Inshallah, Dr. Marwan, next session you can present a case.
اوكي ان شاء الله.
هذا دكتور الدين ولا بكرة؟
Okay, Dr. Rasha.
Okay.
Station 5 عشان تبقى brief case, not long case. Mrs. Mona is 27 years old. She has been complaining of pain in both hands for the last 2 months. Please take focus history and proceed as appropriate.
طيب okay.
Okay.
Good morning or good night.
Good morning, doctor.
I'm Dr. Rashid, Senior House Officer in the Medical Department. Nice to meet you, Mrs. Muna.
Nice to meet you, doctor.
I have received a letter from your GP saying that you have pain in both hands. Can you tell me more about it?
Yes, doctor, I have this pain in both hands for the last 2 months, doctor.
Can you describe for me the pain? When did it start? The last 2 months. Can you describe for me the pain? Hello?
What do you mean described by pain?
Can you describe the character of the pain? Is it throbbing? Is it electrical-like? Is it aching
No, it
pain?
is dull pain, doctor. Dull aching
in both
pain,
hands?
doctor. Yes, doctor.
Okay, is the pain in your hands the severest early in the morning?
No, doctor, it can come any time of the day.
Okay. Can you tell me what increase, how severe is this pain?
It is mild to moderate,
Hello.
doctor.
Okay, is it continuous all the time or it comes and goes?
No, it comes and it goes, doctor.
Do you have night pain? Does the pain come at night?
No specific time, doctor.
Okay, have you noticed anything increases this pain?
Movement, they can increase the pain sometimes, doctor.
Okay, moving like for what? Like typing? Like what? Can you describe which type of movement increases the
moving
pain?
like catching things, writing like that. Doctor.
Okay, anything that relieves this pain?
I'm taking some painkillers, doctor, which can help sometimes.
Sorry?
I'm taking some painkillers, which can help sometimes, doctor.
So does it help?
Partially, doctor.
Oh, sorry about that. Can you tell me, do you have any stiffness in your hands?
Yes, sometimes I have this stiffness, doctor.
How long does it take to let go?
Maybe for 30 minutes, doctor.
4 minutes. Okay. Do you have any swelling in your hands?
Yes, there is mild swelling, doctor.
Which part of where is the swelling exactly in your hand? Can I see?
And the far joints, doctor, the far joints.
The far joint, near your nails.
Yes, doctor.
Okay, do you have any pain in any joint elsewhere in your body?
Yes, doctor, I have sometimes back pain.
You have back pain? Can you tell me where is the pain exactly in your back?
Yeah, the lower back, doctor.
The lower. Can you describe the character of this pain?
Dull aching also, doctor.
Dull aching. Have you noticed anything that increases this pain?
Yes, any movement or vigorous movement can increase the pain.
Anything relieves this pain?
Painkillers can relieve this pain, doctor.
What about activities or movement?
Yeah, it can increase the pain, doctor, sometimes, yeah.
Okay. Does the pain spread anywhere?
No, doctor.
Okay. I would like to look at your hands. I would like
Yeah.
first see if there is any nail changes.
There's some needle changes and the skin rashes and the knuckles, and also interphalangeal joints.
Okay, I'm examining you while taking some history from you, okay?
Yes, doctor.
Okay. Do you have any facial rash?
No, doctor.
Any problems in any soreness in your eye or redness in your eye?
No, doctor.
Any soreness in your mouth?
No.
Soreness down below?
No.
Any skin rash apart from the rash that you have in your hands elsewhere?
No. Yes, doctor, I have rash in my elbows and also rash in my knees. My back also has some rash.
Yes. What about your hairlines and the back of your ears and your back,
No,
the
rash,
navel's
doctor.
areas? No rash. Okay. Do you have any problems? Any recent history of problems in your water work or back passage?
No.
Any change in the color of your hands while you're exposed in the cold?
No.
Okay. Yes. Station 5.
Station 5.
Okay. Okay. Do you have any shortness of breath?
No, doctor.
Okay. Can I know the finding? I'm listening to the chest. If there is any shortness or if any apical fibrosis, listening to the heart, checking the back, for spondyloarthritis, right? Can you take an examination?
Again, doctor?
الفinding في examination.
Yes, there is rash in the elbows and rash in the knees, both knees. Also on the back, and there is in the knuckles and interphalangeal joints and needle changes. And mild swelling and the distal interphalangeal joints mainly. There is no deformity.
Okay. Do you have any pulse?
There
How
is
about your
mild
health
soreness.
otherwise?
It's okay, normal, doctor. But I have just blood pressure, which discovered 2 years back, for which I'm taking I'm taking a treatment for it, lisinopril.
Okay. Do you have any family history of similar problems?
No, doctor.
Apart from painkiller and lisinopril, do you take any other medications? Hello?
No, doctor.
Okay. Any drug allergy?
No.
Can I know what you do for life?
I'm a secretary, doctor. I'm typing. Such this complaint is interfering with my job and affecting my job.
Okay. Sorry about that. With whom you are living?
I'm living with my husband and I have 1 kid, doctor.
Okay. And how does your symptoms affect your daily life also?
For the last 1 month, doctor, it's affecting so much, and I'm feeling so impressed in between my colleagues because of this skin rash, and also I cannot continue my work because of this joint pain.
Sorry about that. Okay, can I know what's your concern?
I'm concerned about this joint pain, doctor. What could be the cause?
Okay, Mrs. Let me tell you, after taking history from you and doing for you a brief examination, the most probably that you have a combined skin rash, a rheumatological disease called psoriatic arthropathy. This is disease affect the skin and also the small joints of the hand. This is account for all the symptoms you have. Unfortunately, the drug you are taking for your for the non-steroidal and also the drug for antihypertensive might aggravate this rash. So I'd rather refer you to the heart doctor who might consider, and writing for you a report, who might consider changing the antihypertensive to another medication that's safe for your condition. Okay. I also would refer you to do for you some investigation and some imaging on your hands is to confirm the diagnosis, and we might referring you to a joint doctor for further plan of management. Also, I will write for you giving for you medical report about your conditions to submit it for your occupational health department. Is this okay with you?
Yes, doctor. This condition can go away completely, doctor?
Let me tell you, Mrs. Mona, that this condition is a controllable one, meaning that if you take the medications and regular follow-up, your condition will be improved, but it does not say that it will go away. With follow-up, your condition will be improved, and medication also.
Okay, doctor. Thank you.
Okay. Do you have any other concerns?
No, thank you, doctor.
Okay, thank you.
So what's your diagnosis?
My diagnosis is that this patient having psoriatic arthropathy with spondyloarthritis.
Yeah. So what investigation you will do?
I will do for her breathing investigation to confirm my diagnosis, doing for her chest X-ray, joint X-ray on the joint, X-ray on the back. Just.
No other investigation for the complication of psoriatic arthropathy?
Chest X-ray, ECG on the heart. Just X-ray, ECG, or echo on the heart.
Okay. Thank you, Dr. Rasha.
Thank you.
Dr. Rasha, she has this advantage that she didn't see the patient, because when she will go, she will see the patient with rash, so that this can ease the case for her. Whatever, we will do a summary about the case. Any case with both hand pain, we have to ask about an onset, when this pain started exactly. Is this being, of course, is this pain coming on all the time with hair? Is it increasing, decreasing, or the same? Where is the site of the pain exactly? Is it in the knuckles, in the knee joints, or far joints? Worsening factor, any worsening factor like movement or cold weather, improving factor like rest or any drugs. Character of the pain, very important, because character of the pain can differentiate you between Raynaud's phenomena and carpal tunnel and joint pain. Is it electric like, or this is in carpal tunnel, or burning like, is it like in carpal tunnel? Is it dull aching like in joint pain? And then to ask about the timing of the pain, is it more at the morning or the night? In the morning it's more, in the night it's more for carpal tunnel, in the morning more for rheumatoid arthritis and SLE and psoriatic arthropathy. Asking about grade of the pain from 0 to 10. 0 is the minimum, 10 is the maximum. Any other joint involved, like back pain. The morning stiffness, this is very important, and for how long? For rheumatoid arthritis, more than 1 hour, and for others, less than 1 hour. Then systemic review for the patient related to the condition. We have 4 questions to ask about: skin rash for psoriatic arthropathy and SLE, loose motions for enterobitic arthritis, burning micturition for reactive arthritis, eye symptoms like pain and redness for anterior uveitis, which is included in anterior uveitis in psoriatic arthropathy, or maybe scleritis or scleritis in rheumatoid arthritis. Then to ask about respiratory symptoms, because such as this patient have apical lung fibrosis, cough, phlegm, coughing up, and cardiovascular symptoms, chest pain and shortness of breath, and racing of heartbeats, because this patient may have aortitis or aortic regurg, or maybe secondary pulmonary hypertension, secondary to pulmonary fibrosis. Social history, medical history, very important medical history for this case, because the patient may be hypertensive and take antihypertensive treatment, which is worsening in psoriatic rash. Family history of similar condition. A drug history also is very important, because the patient may use some drugs which is worsening their condition, like beta blockers, cyclosporin, antimalarials, lithium, NSAIDs, and ACE inhibitor also. Then examination, for any examination of any patient with joint pain, the same examination: look, feel, and move. Look for any deformity, any skin rash, any swelling, any and feel for soreness of the joints and for the warmness of the joints by comparing between the joints itself and the forearm. And the move, this is very important as functional status of the patient, to move for buttoning, unbuttoning, picking up coins, prayer, and reverse prayer sign. Then to look for linear changes of the patient. Linear changes very important also to look for, in the form of transverse ridges and also oncholysis, transverse ridges, subangular hyperkeratosis. Then to check for hairline and behind the ear for any skin rash and psoriatic rash. The respiratory system for apical lung fibrosis, cardiovascular for auscultation of aortic regurg, and signs of secondary pulmonary hypertension. That's all for this case. الآن هي بصراحة موضوع يعني حالات ال body arthropathy اسطمبة واحدة, the same stump in the history and in the examination. لو patient جالك body arthropathy, سواء كان psoriatic arthropathy or rheumatoid arthritis or SLE, the same question would be the same, but the difference would be between the case of the other about the systemic involvement, and the examination would be the same also. Here?
The difference in the answers of the patient.
Yes, every patient with, according to the positive data, yes. all the patients with body arthropathy, onset, course, duration, progression. Any patient with body arthropathy, onset, course, with duration, progression, site of the pain, worsening factor, improving factor, timing of the pain, the grade of the pain, if any other joint involvement, morning stiffness, and for how long. وبعدين في four question fixed board on all. Any color changes when exposed to cold weather for rhinos, any skin for arthritic and SLE, any loose motions for enterobitic arthritis, any burning micturition for active arthritis, any eye symptoms for anterior uveitis and scleritis and scleritis. Then after that will be different according to the case and the data. And I wrote all of these actually in the gouty. طبعا.
يعني
gouty arthritis طبعا بتيجي deformed arthropathy, بتيجي bilateral asymmetrical deformed arthropathy with gouty nodules طبعا. Don't forget. It looks like mimicking the rheumatoid arthritis. All of these, well, I wrote in the papers. Statistics, you'll not waste time for each case for how to deal with. In the papers, it is fixed اسطمبة واحدة. It is fixed scenario for all the cases, and there will be some difference between case and other according to the case and according to the systemic involvement of the case. Look, feel, and move. This is all for all the cases of arthropathy. Then to examine the systemic involvement of the case. Okay, anyone want to add anything? Okay, نتقابل بكرة إن شاء الله 11:30. Marwan, Dr. Paul with us tomorrow for presentation. Also, we'll try for all the candidates who are going for the exam to present, inshallah.
Okay.
Okay, see you. Have a dream. نشوفكم على خير. السلام عليكم.